Good morning student, we will see the competency number 4.4, and in this competency we are studying a disease called as atherosclerosis. What is atherosclerosis? In the Greek, sclerosis means hardening. So in atherosclerosis there is hardening of medium-sized and large size arteries. So this atherosclerosis is more harmful when it is affect the coronary arteries. Coronary arteries obstruction may lead to myocardial infarction, and it is the most common killer in the world. In India, about 20% of the deaths are due to coronary artery diseases. This is in short about the pathogenesis of atherosclerosis. In stage 1, foam cells are formed. Now we will see what is foam cells. When cholesterol level in the body increases, this cholesterol is transported in the blood in the form of LDL. Cholesterol is not freely transported in the blood. It is packed into a lipoprotein called LDL. So LDL level increases. So this LDL get oxidized, and this oxidized LDL is taken up by the macrophages in large quantity, and they will die and they get converted into foam cells. So this is the first stage. In the second step, there is progression of atherosclerosis. Whenever there is increase in oxidized LDL level, this oxidized LDL level leads to damage to the endothelial cell. When there is damage to the endothelial cell, then the smooth muscles below the endothelial cells get exposed, and they are sticky in nature. Therefore, cholesterol start depositing into the smooth muscle. Then third step is fibrous proliferation. When smooth muscle get deposited and macrophages get converted into foam cell, before that this macrophage releases various growth factors. These growth factors causes deposition of collagen at that site. This is called as fibrous proliferation. And in the last stage, the proliferative changes may take place. It becomes larger. There is obstruction to the flow of blood, which leads to turbulence in the blood flow, due to which the platelet get attached to that clot, further increasing the size of the clot, and in this way there is narrowing of the lumen of blood vessel occurs. So this is the figure showing pathogenesis. In the left there is normal artery. The middle artery shows the initial stage of atherosclerosis, and on the right side the yellowish color means deposition of cholesterol. So if you compare the lumen, it is quite decreased in size. Now we will see what are the causes of increased cholesterol level, or what are the causes of atherosclerosis. First is diabetes mellitus. I have told you that in diabetes mellitus blood glucose level is high due to deficiency of insulin. But liver does not require insulin for its uptake. As blood glucose level increases, more and more glucose enters into the liver cell. As more and more glucose enters, it gets converted into acetyl-CoA. So when substrate acetyl-CoA is available, cholesterol synthesis naturally occurs, and liver is the main organ for synthesis of cholesterol. Then next cause is obstruction to the flow of bile, that is obstructive jaundice. Whenever there is obstructive jaundice, the flow of bile does not take place, and the neutral sterols and the bile acids which get excreted through the bile, that pathway stops. Therefore, excretion of cholesterol through the bile is hampered. This will increase the blood cholesterol level. In hypothyroidism, there is deficiency of receptors which take the cholesterol from HDL for excretion. HDL is a lipoprotein which transport the cholesterol from periphery to the liver. For uptake of cholesterol from HDL, some receptors are required. In hypothyroidism, these receptors synthesis is decreased, due to which the uptake of cholesterol from the peripheral blood decreases, and hence the cholesterol level increases in the blood. In nephrotic syndrome, due to loss of albumin, the osmotic pressure of the blood decreases. To compensate that, body will synthesize the lipids. Here all types of lipids increases, triglycerides, cholesterols. So this is nephrotic syndrome. And the last cause is familial hyperlipoproteinemia. It is a genetic disorders seen in some patients in which they have high cholesterol levels. Now some risk factors for atherosclerosis. Cigarette smoking, it is the important cause of atherosclerosis. Cigarette smoke contains nicotine. This nicotine is a potent vasoconstrictor. Due to vasoconstriction of the blood vessel, the blood pressure increases, and when the blood pressure increases and blood tries to flow through the artery, there is damage to the endothelial cell, and whenever there is damage to the endothelial cell, the pathogenesis of atherosclerosis starts, just we have seen. Then high LDL level, the cholesterol is mainly transported through LDL lipoprotein. So whenever there is high LDL level, there is increased cholesterol and chances of atherosclerosis are more. Decrease HDL level. HDL, high density lipoprotein cholesterol, it is a good cholesterol. It transports the cholesterol from periphery to the liver for excretion. If HDL level is decreased, then chances of atherosclerosis are increased. High fat and cholesterol intake, also important risk factors for atherosclerosis. Diabetes mellitus, just now I have discussed, it is a important cause as well as it is a risk factor for atherosclerosis. Hypertension, whenever there is hypertension, I have told you, there is rushing of blood through the narrow blood vessel, due to which there is endothelial damage, and this endothelial damage start the process of atherosclerosis. Physical inactivity, also an important cause of atherosclerosis. Next cause is obesity. Again, obesity leads to insulin resistance, increase in the blood glucose level and increase lipid level. Intake of long chain fatty acids, mainly saturated fatty acid, for example stearic acid, it causes damage to the endothelial cell. It significantly affects the performance of the endothelial cells. Then lipoprotein A level. This lipoprotein A level has anti-fibrinolytic activity. That means it inhibits the process of fibrinolysis. Whenever there is fibrinogen deposit occurs at any place in the body, that fibrin is removed by scavenger cells of the body by the process of fibrinolysis. But this lipoprotein A inhibits the process of fibrinolysis. High triglyceride levels means presence of high neutral fats in the body. Then homocysteine levels, high homocysteine levels. Homocysteine is formed during the metabolism of methionine. This homocysteine directly damages the endothelial cell if its level is increased, leading to the process of atherosclerosis. Stress is also an important cause of atherosclerosis. During stress, the stress hormones are synthesized. These stress hormones increases the blood pressure, which damage the endothelial cells. So these are the some modifiable risk factors of atherosclerosis. Now these are non-modifiable risk factors of atherosclerosis. Age, gender, male, female. Here males are more affected than females because estrogen present in the female have protective effect against atherosclerosis. Family history of cardiovascular accident, also important cause of atherosclerosis. These are non-modifiable factors. Now how will you prevent the atherosclerosis? To prevent the atherosclerosis, you have to reduce the cholesterol and fat intake. Then you have to also limit your carbohydrate intake, and especially the refined sugar like sucrose we have to stop. Then we have to increase the intake of polyunsaturated fatty acid, mainly omega 3, which is found in fish oil. Then we have to increase the green leafy vegetables, intake of green leafy vegetables, so that our bowel movement should be regular. Then risk factors like smoking and alcohol, they should be avoided. Regular exercise should be there, and we have to avoid the trans fatty acids intake. So these are some preventive measures for atherosclerosis. Now treatment, the main choice of treatment is the drug statins, and I have told you how these statins will act. Statins competitively inhibit the enzyme HMG-CoA reductase, which is the rate limiting enzyme of the pathway. So cholesterol synthesis decreases in the body. Second drug is cholestyramine. Now this cholestyramine is a bile acid binding resin which causes increased excretion of bile acid into the stool. Whenever there is increased excretion of bile acid in the stool, more and more bile acid is synthesized from cholesterol. That means cholesterol is converted into bile acid. So in this way cholesterol level is decreased. Third type of drug is propofol, which increases the catabolism of LDL. Now many times a case is asked on this topic. So this is one example of case. A 32-year-old man having heavy smoker developed sudden crushing chest pain. He was admitted to the casualty department. Myocardial infarction was confirmed. Now questions are, is there any relationship between smoking and myocardial infarction? Yes, it is a role. What is that role? Smoking causes, that nicotine present in the smoke causes vasoconstriction. Vasoconstriction leads to increase in the blood pressure. Increase in the blood pressure leads to damage to the endothelial cell, and this damage starts the process of atherosclerosis. Now what are the preventive measures against the development of heart disease? So these are the preventive measures we have to take to prevent the process of atherosclerosis. And third question is, name the lipoprotein which have protective effect against the development of myocardial infarction. That lipoprotein is HDL, high density lipoprotein. Fourth question is, name the enzyme which are likely to be elevated in myocardial infarction. So enzymes like CPKMB, which is isoenzyme, SGOT or AST, and third is LDH. So these are the three enzymes which increases in early stages of myocardial infarction. So this is about atherosclerosis. Thank you very much.